equipment required is available, and prepare the equipment using aseptic non-touch technique. Prime the needle-free connector, if using, with sterile 0.9% sodium chloride. Place the tourniquet around the arm and allow a few seconds for the veins to fill and become distended. With gloved hands, palpate the vein chosen for cannulation. Use an antiseptic wipe to clean the area and allow the skin to dry. Do not palpate the skin again after cleaning. Use the non-dominant hand to grip the patient's hand. Hold the skin taut and immobilize the underlying vein. Holding the needle and cannula together in the dominant hand, confidently puncture the skin at an angle of 30 degrees until the needle tip pierces the vein and a flashback of blood is seen in the hub of the needle. Advance the needle and cannula together at an angle just less than 30 degrees for a further 1 to 2 millimeters to ensure that the tip of the cannula has entered the lumen of the vein. Using the wings at the base of the cannula, advance the cannula over the needle while holding the needle steady. Advance the cannula up the lumen of the vein as far as possible without resistance, while flattening the angle of entry further until the base of the cannula reaches the insertion site. Carefully remove the tourniquet. With the thumb of the non-dominant hand, carefully occlude the end of the cannula with gentle pressure as the needle is removed completely. Dispose of the needle into a sharp spin, and if required, take blood from the cannula before flushing or administering drugs or fluids. Attach the cap or the needle-free connector to the hub of the cannula. Attach a cannula dressing to fix the cannula in place. Use a sterile 0.9% sodium chloride flush to ensure that the cannula is patent, and attach the infusion or giving set as required.